I want to express my deepest sympathy to the many families who have loved ones who've died by euthanasia. Canada is surpassing 100,000 deaths by euthanasia this month, a very sad milestone. That's since, of course, legalization. I remember Gaétan Barré, then the Quebec health minister, stating in the Quebec National Assembly in 2014 that this would be for extraordinary cases only, likely 100 per year in Quebec. Euthanasia now represents 8% of all deaths in Quebec. Jocelyn Downey, a longtime euthanasia academic, told the Canada's Parliamentary Special Joint Committee on Medical Assistance in Dying that is studying euthanasia for mental illness alone, that Parliament must stick to this March 17th, 2027 timeline and permit euthanasia based on mental illness alone. Downey threatened the committee by stating, what will happen if there is an extension or exclusion is that people will die by suicide. Downey is saying that the answer to suicidal ideation is suicide. And people will die by suicide if they don't have access to euthanasia. The threat that people who are denied euthanasia will die by suicide is a false pressure tactic. The Supreme Court of Canada accepted this suicide argument also in Carter. But they were also wrong. Because if the premise that people will die by suicide if euthanasia is not available to them is correct, then the suicide rate should go down after euthanasia becomes an option for Canadians who are not terminally ill. But Canada's suicide rate has increased. According to Government of Canada's suicide mortality stats, there were 3,978 recorded suicide deaths in 2016, the year that Canada legalized euthanasia. In 2021, there were 3,927 recorded suicide deaths. That's the year that Canada expanded euthanasia to people who are not terminally ill. But in 2023, 2 years after extending euthanasia to people who are not terminally ill, that very group you would think that were avoiding suicide, there were 4,735 reported suicide deaths in Canada, representing a greater than 20% increase over the 2-year period. So I'm not arguing that Canada's increase in suicide was directly related to Canada's expansion of euthanasia, but I am saying that if Jocelyn Downey was correct, the suicide rate should have decreased, whereas in fact it has significantly increased. Canada's had a massive increase in deaths by euthanasia. Health Canada released their 6th annual report last year on November 28th. This was for the 2024 deaths, and it indicated a 6.9% increase that year. And it said that we had 16,499 reported made euthanasia deaths in 2024. In 2025, we know that euthanasia increased by 7.3% in Ontario. We have the Ontario data. We know it increased by 11% in Alberta. I predict that in 2025, the increase in Canada's euthanasia deaths was probably greater than 7%, with the number of euthanasia deaths being probably approximately, just by doing the math, around 17,700. Clearly, there's no indication that the massive growth in Canadian euthanasia death has resulted in a lower rate of other suicides. Suicide rates do not decrease in jurisdictions that have legalized euthanasia or assisted suicide. How do I know this? Well, I responded in December 2020 to a statement by Senator Stanley Couture, who's a Canadian senator, who said, in jurisdictions such as Belgium and the Netherlands, where assisted death is legal, that suicide rates have decreased. He then stated that there's no link between assisted death and the rate of suicide in jurisdictions where it's legal. The problem with the senator's comments is that they were absolutely wrong. In that article that I responded to him, I explained that there is no jurisdiction that has legalized euthanasia or assisted suicide that over a long period of time have experienced a decrease in suicide deaths. In February 22, bioethicist David Elbert Jones published an article titled, "In Europe, Suicides Rise After Right to Die is Legalized." Jones provided a comparison between European countries that have legalized assisted dying, so euthanasia or assisted suicide, and those that have not, and found that countries that have legalized assisted dying experience an increase in suicide rates compared to countries that have not legalized assisted dying, who at that time had generally had a lowering of their suicide rate. In other words, Downey is using a false argument to scaremonger members of Parliament into approving euthanasia for mental illness alone. Downey uses the court decision to uphold her position, but the justices were actually wrong about this. And in fact, they're not experts. The experts are the physicians who deal with the patients who have mental health issues. Minimally speaking, legalizing euthanasia does not lead to a decrease in suicide rates. There's no data that ever would suggest that or prove that. In fact, there seems to be more of a suicide contagion effect in every single jurisdiction. We mourn 100,000 euthanasia deaths in Canada since legalization, and we challenge the federal government not to expand Canada's euthanasia law, but to launch a study by neutral researchers, because currently all the studies that they've launched have been by pro-euthanasia researchers, on the effect of Canada's out-of-control euthanasia regime. As for the Bill C-218, it's actually not being voted on this week. That was delayed. Nonetheless, euthanasia for mental illness alone, we believe, is absolutely the wrong way to go. Thank you very much.